All right. So I'm sure you guys have many reasons why you're attending. Maybe you know somebody that had a cybersecurity breach. Maybe you had one yourself. Um, Today I'm going to be talking a little bit about how the cybersecurity landscape is affecting healthcare. We're going to talk just a little bit about the new HIPAA rule that's coming into effect. Last week we shared that the um, requests for comments were ending. So if you guys are healthcare providers and were able to participate in providing comments to that, congratulations, thank you. It's a very, very important process. We're talking a little bit about who is actually impacted with this, talking about a couple of case studies with a couple cybersecurity breaches that have happened recently in healthcare, costs, again, things that you have control over, and how are you able to leverage this for growth and success in your practice. Again, my name is Ken Kuna, my own North Star Technology Group. Dan DeFay is not able to join us this week. He is our Chief Security Officer. We essentially, our mission is to help healthcare providers protect their reputations and their information. We have 32 employees. 27 of them are cybersecurity and technical engineers. We've been lucky enough to actually make the Inc. 5,000 list as one of the top 5,000 fastest growing companies in the United States. And we are currently the Faces of Cybersecurity Award winner. Essentially, I like to say we are superheroes for healthcare. So what's really going on? Of course, if you have IT departments, I guess naturally assume that those IT teams are protecting you, and hopefully that's the case if you're partnering with a good firm or if you have a good cybersecurity team on staff. But typically, this is not the case, and why is that? Well, typically most IT departments are focusing on infrastructure. They are focusing on how to make things fast, how to make sure that they're available, those type of things. And the skill set to provide protective services, and especially, of course, understanding the compliance needs for HIPAA is often a very different set of skills. And so we often see a disconnect between what people think is going on and what really needs to happen. And according to Insight Integrity 360, 78% of organizations still think that they're cybersecurity resilient is insufficient. And so we're seeing a big disconnect between the investment that people make in IT and their actual outcomes. So who does this impact? So I do this analogy every time. Again, this is a virtual briefing, right? But I do a lot of in-person conversations, and I always ask the question to the room, how many of you know somebody that's been in a car accident? And you get a smattering of hands. And then I ask how many of you know somebody or an organization that's gone through a cybersecurity breach. And more times than not lately, more people in the room have experienced or know somebody that's had a cyber breach than a car accident. And so today we're going to talk about Warby Parker. So Warby Parker, if you've seen any of their TV commercials, and they're all over the internet, right? They are one of the fastest growing providers of prescription glasses, right? So technically they do fall into HIPAA because they have to protect patient information regarding prescriptions for eye exams and be able to produce those and manufacture those glasses. So what happened? So Warby Parker ended up having a cybersecurity breach that happened actually way back in 2018, and now the health the OCR and HHS are fining Warby Parker $1.5 million to resolve those HIPAA violations. So what happened is the hackers gained access to customer accounts from their public website. And the attack vector was what we call a credential stuffing attack, where usernames and passwords are obtained in a data breach at an unrelated entity. So think about that a little bit. You could have a bunch of different cybersecurity controls in place, right? You could be maybe doing a lot of the right things, but somebody else has a data breach, right, and grabs credentials. Well, how could this happen, and how would this affect Warby Parker? Well, what is human nature is that people often use the same credentials that they use for their public and corporate environments, email address and passwords, and they use that to register for other things, right? Maybe it's LinkedIn, maybe it's other social media platforms, maybe it's other websites, other cloud services, right? And so they end up, because it's easy, they end up using their same user IDs and passwords. Well, in this event, data was compromised, and they ended up getting breached. So why the fine? Well, what happened is Warby failed to conduct an accurate and comprehensive risk assessment, which is a HIPAA requirement, right? And so um, let me tie into kind of what's going on with some of these new HIPAA compliant security rules, right? And specifically to this Warby Parker case. I'm going to be doing a lot more of these briefings and some webinars. We're going to do some longer deep dive webinars and dive into our podcast about the new updated rules. But I want to touch a little bit about what happened with Warby. So the new HIPAA rule is, as I mentioned, requires a compliance audit every 12 months, right? And obviously this is an important step. I always talk about, if you know me at all, heard me talk about cybersecurity risk assessments and the importance of that. But the big thing here is that it needs to happen at least once a year. And part of that assessment are some of these new rules, right? You need to have a comprehensive asset inventory. You need to make sure that you have a list of all of your assets. You need to make sure you have a network map of data flow coming in and out of the environment. That's something new that we've never really had to do before, and that has to be updated annually. We also have CMMC customers, that is the DoD's cybersecurity framework, and this is something that we have to do with those level 2 CMMC customers that work with prime DoD contractors. You need to make sure that all systems, not just the systems that process health information, are in scope of this HIPAA assessment. It used to be where we could just assess and put cybersecurity controls around where PHI was, right? But now that is becoming more and more in scope. Everything is becoming more in scope. And I'm just going to fly through this quick because this is a short thing, right? But some of the things that I'm going to be talking about shortly. There's many rules or many things that used to be what they call addressable with the old compliance, where you could say, hey, this is just not feasible for me to do. Here's some alternative controls. And it would be okay. Those are going away. All addressable controls are going away. So everything that in this rule is required, and that means mandatory encryption, right, for your PHI. It's forcing multi-factor authentication. You may say, well, that should have been the way it was before. It really wasn't. It was still an addressable thing. We have to have that annual cybersecurity review. We need to make sure we have the asset inventory list, penetration testing, which is something that we haven't really been required to do. We do vulnerability assessments to check to see if something's vulnerable or not. Now they're asking for us to actually test and do pen test in that. We have to do enhanced cybersecurity awareness training specifically for HIPAA-related topics. And as a provider, you are required to have this training completed within 30 days of hiring new people. We're going to have to work through updating our incident response plans and breach reporting plans. A lot of you have heard me talk about the projects that we're going through with some of our existing customers about security tabletop exercises and business continuity plans. We need to do enhanced incident response plans. What do we do if there is a breach? Stronger access control measures. This is going to be primarily around what types of passwords we can use and the requirement of using password managers. There is going to be an expanded business associate accountability. So business associates must provide written proof of security measures. So if you have your BA agreements with vendors, they're going to have to provide written documentation on how they're handling security. And then we have a significantly large increase in the amount of documentation that we need to provide. So what does all this stuff cost? Well, obviously there's substantial financial losses. I don't want to go into the details, but if you've ever experienced or know a healthcare facility that's gone through a breach, the reputational damage in the community, staff, um, concerns and trust, leading to possible turnover, all the regulatory fines, all of these things are huge impacts. Um, what do you have control over, right? I talked about some of these cybersecurity controls that will be required in the new HIPAA rule. The biggest thing you have, of course, is assessment and audit. Know where you stand, right? Get a review done to make sure that at least you understand what gaps you have. Invest in a trusted partner, and of course, just do something, right? My team always hears me talk about the importance of, uh, you know, uh, done is better than perfect, right? Sometimes we go through this analysis paralysis and we just like keep thinking through all the circumstances. Just get moving on it, finish it. Uh, Talked about cybersecurity risk assessment. Can't stress that enough. With HIPAA, with the new rule, it's required annually. Get it done. Uh, For those of you that are not customers of mine, or even if you are, schedule some time with me. Current customers, we're reaching out for our strategic business reviews. You can get a mini one with me even if you're not a customer. So hit that QR code, book some time with me, and I'd love to be able to help you. We have some time for questions if there's anybody that has anything that they want to talk about. Um, I'm going to let attendees chat. If there's anybody that has anything that they want to talk through, just let me know. Again, we have lots of people on this call, and some of you guys are current customers, some of you guys are not. If you're not a current customer, reach out for a cybersecurity strategy session. If you are, you can still do that, of course. And also we'll be reaching out regarding our strategic business reviews, business continuity planning updates, incident response planning updates, and cybersecurity tabletop. All right. If I don't have any questions, I'm going to give you back some of your day. I hope everybody has a great day. Thank you so much.